The Department of Health has put together some statistics looking at the incidence of COVID-19 per 100,000 people. And what it shows is that Hispanics are the most likely to become ill, followed by African Americans, and then Native Americans and Hawaiians and Pacific Islanders. How do you read this data? Does this look to you surprising or not?
Well, you know, it's always distressing to see it show up again and again and again. But frankly, it's not all that surprising, given that we know that these very populations, indigenous and people of color, are employed in some of the very sectors that have the highest exposure potential, employed in healthcare, long-term care specifically, big congregate workplaces like the food processing plant outbreaks that we've seen. Living conditions, often are more congested. So again, it's not about the biology of the people, or their behaviors necessarily. It's about their circumstances. We do know, because of the inequities also in rates of chronic disease caused by so many things, systemic racism and the stress that we now know what that does to our bodies over time. Chronic diseases are much more prevalent among these same populations. So it's distressing, but not surprising, that if they are differentially exposed to the virus, which they are by virtue of their living and work settings, they are also more susceptible to more severe cases of the illness because of their underlying health conditions.
Thank you.